Hi, I'm Dr. Rena Azar. I'm going to talk a little bit today about post-operative care. People are oftentimes wondering what that's going to look like. How often will they be coming in? What will be done when they do come in for their post-operative appointments? Who will see them? So I determine, as do my nurse practitioners, the timing of and the nature of the exam based upon you as an individual. That means I'm looking at what kind of surgery you had, how the surgery went, how the post-operative course in the hospital went. Do you have underlying risk factors, certain health factors like diabetes, cardiovascular disease, autoimmune disease, something that affects your ability to heal well? I'm also looking at you as an individual and what kind of support you have at home. Some people have nurses living in the household with them, so those are people that can help keep an eye on them. So the timing of office visits is very much individually determined. At the time that you leave the hospital, I will determine when I think you next need to be seen. And the nurse practitioners do the majority of the visits. Even though I would like to do all of my post-operative visits, it's not feasible. I don't have enough time to do post-operative visits and handle seeing new patients that come in that have a problem that I need to help them with that somebody else can't help them with. Kristen and Deb are my nurse practitioners. They've been with me a long time. They're both very well trained. They're excellent. We have open communication every day. They call me all the time and run things by me if they've got any concerns about what they see or what you tell them. They will determine when your next visit is. When you come in for your visit, most of the time your abdomen and your vaginal area will be examined. When we see you in the office, we're looking for signs of infection. We're looking for signs of any kind of complication that can occur. And we like to catch things early. Catching things early with a problem post-operatively is always key to making things go smoothly. Through the years, through the last couple decades that I've been doing surgery, I've always found that if we catch a problem, we catch it early, take care of it, we don't run into long-term big issues. So that open communication, frequent visits, letting us lay our eyes on you, letting us get a history in person, those are really important factors for your visits and for your care. Post-operatively, for my larger pelvic floor surgeries we're really trying to correct a lot of functional problems, I do always like to see people 6 months out and intermittently in between, but the 6-month out appointment is a really important one to follow up. I like to go over with you all of the functions of your female parts and make sure that they're working satisfactorily to you and to me. And oftentimes if people are having problems that may still persist or maybe new problems, we can address them. These are big surgeries. We're correcting issues that have been underlying generally for a very long period of time, and it can take a little while and some fine-tuning things that we can do to fix everything to make everybody happy, yourself and myself. So that is how we determine, and that is kind of how the post-operative visits go. Patients all have my phone number. My surgery patients have my phone number, either from the videos or they can call the office if they've got questions or concerns that they're worried about or feel like are not being addressed. But we see people frequently and keep close eyes on them to give them excellent care so that we can get the excellent outcome that we all want.